So Megan, thanks so much for being here today. I appreciate you coming here to talk a little bit about your experiences with Spanish for the health profession. Can you talk a little bit about the value, what has been the value of taking the Spanish for the health professions classes, specifically the 210 and the 211?
Okay, I took those in high school, and I originally was interested in Spanish, but this really got me interested, and I did it so I could have the skills to go on a medical mission, and it definitely prepared me for that, but I think just those two classes and the medical mission kind of changed the course of my life. Like, it really made me interested in becoming a doctor and also in learning Spanish so I could serve patients. So since then, I majored in Spanish in college, and I went to the Dominican Republic to teach English, which I don't think would have happened if I hadn't taken those classes. I also used it in the clinic when I worked in the clinic, and then I recently passed my Spanish interpreter qualification test.
Oh, congratulations. Felicidades.
Gracias.
So when you started taking the Spanish 210, even though you were still in high school, you had an immediate use. You immediately were able to use what you had learned in those courses. Can you talk a little bit more about that?
How I used it in high school?
Yeah, after you took the class in high school, how you were immediately able to start integrating your Spanish knowledge into everything you were doing.
Yeah. So I used all the vocabulary. Well, I think first of all it kind of jump-started my Spanish because it was a bit more advanced than in high school, so I got a lot better at Spanish and able to speak. But then all the vocabulary I used when we were on the medical mission, and I was able to, run a little pharmacy or help interpret for my mom, who's a physician assistant. And I just think then that continued into college, and I did continue to use it in the clinic as well.
Okay. And so it was a little bit challenging. You had to push yourself a little more than you had in some previous classes, but in the end it worked out.
Yeah, I think it was hard for me at first, but then once you get started, it becomes a lot easier and you learn so much. Your Spanish gets a lot better.
And you don't speak Spanish at home, so.
I do not speak Spanish at home.
Well, maybe now you do.
Only when my mom wants to practice.
And now that you're graduated and you've been accepted into medical school, congratulations. How do you plan on using this information, the language, the cultural information in the future?
Well, I really want to use it as a doctor. Like I said, I want to go into an area that serves Spanish-speaking patients in the future. But for my rotations, my clinical rotations, I got placed in Haley, Idaho, which has a lot of Spanish-speaking patients. And so I even went there this summer, and they have to use interpreters every single day.
Every single day?
Every single day. And so now, with my knowledge of that, I could, use Spanish to speak to the patients myself, too.
Yeah, and with your interpreter certification, you can either be an interpreter for another provider, or as a provider, you'll be able to have that one-on-one relationship.
Yeah.
And not have to rely on an interpreter.
So I'm really excited. I'm excited to do that, and then to continue with my education, and then hopefully I could go abroad again and keep using it as a doctor too.
That sounds like a good plan.
Thank you.
Well, thank you so much.